Hello and welcome to my presentation on efficiency of occupational therapy for patients with Parkinson's disease. The reason for why I decided to choose this topic was because I wanted to see how occupational therapy can help people with Parkinson's disease. Parkinson's disease is a neurodegenerative disorder which affects approximately 1 million people in America, 1% of the Australian population over 55 years of age, and it is greater than 3% of Australians aged 75 years and above. The research papers to date involve 1 systematic review and 2 randomized controlled trials. The systematic review is written by Foster et al., and it is the latest one to date, which is published in 2014. The first randomized controlled trial article is titled Efficacy of Occupational Therapy for Patients with Parkinson's Disease, a Randomized Controlled Trial, and that is by Sturkenboom et al. 2014, and the other article is by Tickle. The search strategies that were used to find these papers was through the PubMed database. The search keys were occupational therapy, Parkinson's disease, systematic review, and I used the second result, which was by Foster et al. 2014. The search articles for the randomized controlled trials, the keywords were using occupational therapy, Parkinson's disease, 2014, random control trial. The reasons for why I only used random with a star was because randomize can be used and spelt differently depending on the English of where it's originated from. The first result that came up was by Sturkenboom in 2014, and that is one of the randomized controlled trials. The other random controlled trial article that I used was from Foster et al.'s systematic review. The level of available evidence for occupational therapy in regards to Parkinson's disease was actually quite limited, but there were plenty of physical therapy-based research. The systematic review today used the database search between the years of 2003 and 2011. To determine the quality of evidence in the randomized controlled trial journal articles, it is possible to do by using the Physiotherapy Evidence Database Scale, which is otherwise known as the PEDRO scale. Another way to work out the quality of evidence in a journal article is to use the consort statement. To evaluate the quality of randomized controlled trials today, I'll be using the PEDRO scale. The PEDRO scale consists of 11 different criteria. The overall rating is rated out of 10, and so the first criteria of eligibility is not included. Looking at the first journal article by Sturkenboom et al., it is rated 7 out of 10 on the PEDRO scale. This could be considered a high-quality research study, which is a level 2 on the NHMRC. The researchers did not blind subjects or therapists, but did their best to blind assessors. Therefore, the chance of bias is still possible. The other randomized controlled trial by Tickle, Degnan et al. Rated 8 out of 10 on the PEDRO scale. The sources of bias in these randomized controlled trials were noticeable. In Sturkenboom et al.'s paper, the reporting could have been biased from participants. In the paper, it was stated that the data analyzed was intention to treat, but if you look at table 2 and 3, the participant numbers stated otherwise. The baseline participant numbers were greater than the participant numbers at 3 and 6 months. Therefore, the analyses did not have intention to treat all participants. In Tickle, Degnan et al. Study, there may have been reporting bias. Foster et al.'s systematic review found people with Parkinson's disease can benefit from interventions that focus on occupational performance and physical performance skills. They can provide environmental cues, include physical activity, self-management, and cognitive behavioral strategies into daily life. Sturkenboom et al.'s randomized control trial found occupational therapy can benefit patients with mild Parkinson's disease. Tickle-Degnan et al.'s randomized control trial study found specific domains of health-related quality of life. The communication was strongest at the conclusions of these papers state that people with early to middle stages of Parkinson's disease should consider self-management rehabilitation to improve and sustain health-related quality of life. Further studies need to be completed for definite findings, as the occupational therapy studies are very limited. There is work in progress at the moment by Clark et al. In 2009 and Sturkenboom et al. In 2013, yet to be published. I'd like to thank you today for listening to my talk on efficiency of occupational therapy for patients with Parkinson's disease, and I hope as an occupational therapist you are able to apply these research findings in your practice.